Okay, this is Dr. Mcdougall, part 4 on cancer from the book. Mcdougall, the doctor who fought for you by me, P. Rogers. Okay, so we just finished up with talking about the Cochrane collaboration. Peter Gotsky, who wrote a book about mammography, saying it was basically a waste of time. It just stresses out the patient and hurts more people than it helps. Okay, Dr. Mcdougall continues here, talking about cancer, breast cancer in particular. 8 randomized studies of breast cancer screening were performed in women over 50 years of age, and only 2 showed benefit, so 6 did not. Let's see here. Oh, another one. The health insurance plan in New York showed 1 less death per 7,086 patients screened. And think about all the hassles those patients had to go through to have theoretically 1 less death. Okay, Canadian studies, 0 survival benefit no matter how many mammograms done. Let's see here. So this is a great thing about Mcdougall. Mcdougall's great about collecting all the references. So you have it all in one spot when you want to debate an issue, when you really want to study an issue. So it saves time having Mcdougall stuff. A big part of what I was doing with this book was just trying to organize Mcdougall's material better. Here's another quote by Charles Wright and Barbara Mueller. They said, since the benefit achieved by mammography is marginal and the harm caused is substantial, the costs incurred are enormous. We suggest that public funding for breast cancer screening in any age group is not justifiable. So that's kind of the joke of it, you know. Everybody wants to go for a screening test, but nobody wants to just eat the low-fat, low-sodium vegan diet and stop putting, deodorant in your armpits with aluminum and shared lymphatics. Okay. Many patients that undergo screening mammography end up overdiagnosed. Overdiagnosis is detecting a cancer that would not have caused any symptoms in the patient's lifetime. Okay, so let's scoot this over. Okay, there's several ways to reduce exposure to estrogens. Number 1, you can remove the ovaries. It's a pretty big thing to do. Number 2, you can take tamoxifen. Number 3, you can take aromatase inhibitors. That's like the enzyme in fat. You can have chemotherapy. You can eat a starch-based vegan diet with no animal foods. You can filter your water. You can lose weight. Fat cells make estrogen. When you lose weight, you make less estrogen. Yeah, aromatase is the enzyme in fat cells that converts like androgens to estrogens. Okay, Dr. Mcdougall continues. Mammography has no advantage over lumpectomy. This was evaluated by a random trial, 20-year follow-up of randomized trial comparing total mastectomy, lumpectomy, and lumpectomy plus radiation for treatment of invasive breast cancer. There was no significant difference in overall survival amount for the treatment groups. Okay, so basically mastectomy was a waste of time. Okay, now another reference, breast conserving surgery with clear excision margins and adjuvant endocrine therapy showed no survival benefit from adding radiation to the breast. There was a higher local recurrence rate in the no radiotherapy group of about 9.5% compared to 1%. So that's actually a difference there. But radiotherapy did not improve survival in breast cancer per this reference here. Chemotherapy for breast cancer is chemical castration. Polychemotherapy for early breast cancer, evaluation of trials. Postmenopausal women do not benefit from chemotherapy because their ovaries are already gone. Okay, so what he's basically saying is chemotherapy wipes out the ovaries, and that theoretically maybe has some benefit in a premenopausal woman for lowering her bodily estrogens and the likelihood of breast cancer progression. But in a postmenopausal woman who doesn't have ovarian function anyways, it was kind of pointless, is what he's saying. Okay. All right. Okay, a few words on colon cancer. This is Dr. Mcdougall continuing. There is zero benefit from screening colonoscopy. Gastroenterologists were very upset by this study, the Nordic study, but those are the results. However, sigmoidoscopy does appear to be the only type of cancer screening that is beneficial. Sigmoidoscopy only bills for about $200, but colonoscopy bills, so I look at where does that number sign come. That comes from the 3. So colonoscopy bills for about $3,000. The Nordic European Initiative on Colorectal Cancer, Nordic study, from October 2022 in the New England Journal of Medicine with a lot of patients, 85,000 patients, okay, showed no significant change in the number of patients who died in the scoped versus the non-scoped group over 10 years, okay. So that's a big statement. And so anyways, you notice how the younger guys, like that guy William Bolshevitz, he's a smart guy, and I think his book Fiber Fields is a very good book, but he's very gung-ho on colonoscopy, and I think that's partly because he's young. Number two, because he's a gastroenterologist. If you're a gastroenterologist, you have to praise colonoscopy. If you don't praise it, you'll piss off all your colleagues, okay? You'll piss off device makers, okay? You won't get interviews, okay? That's another thing I like about an old guy like Mcdougall. He doesn't care. He'll just tell you what the truth is, okay? Whereas when you're young, you're more optimistic. You're sort of fresh out of medical school and residency and fellowship, and you sort of believe everything you were taught. The more clinical experience you get, the more objective your judgment becomes. Okay, Mcdougall continues, if you have a negative colonoscopy, it will take another 15 years to develop cancer, and then that will take another 15 years to kill you. So you've got 15 plus 15 years before you could die, 30 years. If anyone is recommending colonoscopy screening to you, you could tell them about this lecture and show it to them. Okay, the 2016 Canadian guidelines do not recommend colonoscopy for colon cancer screening. Mcdougall says, though it is reasonable to do a screening flex sig between the ages of 60 to 75 years old, which does appear to reduce mortality from colon cancer as much as 43%. You only have to do this once in your life. So that's one thing that he says is maybe reasonable. Okay, and there's some of Dr. Mcdougall's references, like his newsletter. It says, colonoscopy is a gold standard to refuse. Okay, and he's got other newsletters, and he's got videos about all this. Okay, few correctly recognize that reduced mortality in a randomized trial constitutes evidence of benefit of screening. The only evidence. To be beneficial, a cancer screening test must not only delay death, it must reduce overall mortality. Okay, I think we'll end it there for this is cancer lecture number 4 from Dr. Mcdougall.